online seminar or webinar series is organized by three economics associations in Sri Lanka. And many of you who have been participants in the previous webinars know that committee consists of members from the Sri Lanka Economics Association, Sri Lanka Agricultural Economics Association, and the Sri Lanka Forum for University Economists got together to organize this event. So on behalf of the organizing committee, I like to welcome and also say good evening to participants from Sri Lanka and good morning to participants from other regions. We are starting a little bit earlier than usual, hoping that we can get around the disruptions from power cuts by starting at this time. And we may not be totally secure from it, but let's try our best to keep everyone together. Now, the key objectives of the webinar series, as we have explained also before, is to raise awareness about the current crisis, the causes of the crisis, and then promote a national dialogue based on evidence, because we need, we've seen the need for having a proper dialogue that is based on facts. And then the need to also develop, say, consensus where possible among the various professionals, and then communicate that to the public. And also, eventually, if we are well positions, we may go ahead and submit proposals to the authorities from the economics associations as our proposals for address the ongoing crisis. The topic for today is social safety nets, looking after the poor and vulnerable. And this particular need, the need to protect vulnerable groups and reducing poverty as we are addressing the crisis, has been underscored by all the agencies who are working with the government, like the IMF, the World Bank, and all other development partners. And as part of that, the need for social safety net programs has been recognized. Now, we had an experience of that during the COVID, when there were lockdowns. There were groups of people that were affected adversely who needed some sort of protection, which was attempted by various programs through the government. But the current crisis is quite different from that we experienced during the COVID. As you know, the scale of the crisis and the capacity of the government are both quite different from the time of COVID. We did not, during COVID, experience this kind of situation island-wide. Now, this one is a nationwide phenomena. Then the magnitude of it, in terms of the number of people affected. Many people who were capable of looking after themselves during the COVID lockdowns are no longer in that position. So in that sense, this is much more deeper crisis that the government has to deal with. And to make matters worse, of course, we are experiencing this crisis at a time there are, let's say, global disturbances from war in the Europe, and which has caused rising energy prices, and then rising food prices, and probably some supply limitations. And on top of that, Sri Lanka has a self-made crisis that we are trying to deal with. As some of you might have already noted, the United Nations issued an appeal on behalf of Sri Lanka. And in doing that, the UN actually observed that Sri Lanka is experiencing a multidimensional crisis compounded by food insecurity, threatened livelihoods, shortage of essential medical items, and rising protection concerns. So these are the matters that are up for discussion today. To do that, we have three presenters joining us, three eminent researchers and analysts who will assist us maneuver through this process. And in terms of, say, the way forward, may I just mention that while the session is on, while the speakers are making their presentations, please keep your microphones muted and others who are not participating. And then once we finish the 3 presentations, our plan was to have a discussion after all 3 presentations. But the second presenter, Dr. Kalana Piris, has to leave a little bit early. So we will try to have some quick questions directed to him after his presentation. And you are invited to type in your questions in the Q&A or in the chat box so that everyone can see the questions, because I think most questions people raise will be of value to, the responses will be of value to everyone. So we like to see that everyone sees the questions and then direct them to the presenters. Okay, let me maybe invite the first presenter. We will go sequentially. Our first presenter today is Dr. Dileni Gunawardena. She is Chair Professor of Economics in the Department of Economics and Statistics of the University of Peradeniya. She holds a doctorate in economics from American University, Washington, D.C., and also a graduate of the University of Peradeniya in economics. She had been a Fulbright scholar, Brookings Institute scholar, and got involved with a lot of research in this area with the Global Development Network. She has conducted research and published extensively on gender and ethnic wage gaps, child nutrition and growth, consumption, and multidimensional poverty. And her work has been used by international agencies like the World Bank in as background material for Human Development Reports and the World Development Report. And she's also involved closely with the Millennium Development Goal monitoring progress monitoring process in Sri Lanka. So Professor Gunawardena is one of the best resource persons who can help us with this process today. So I invite Professor Gunawardena to commence her presentation. Over to you, Professor.
Thank you very much. Thank you very much to the organizers for inviting me to be part of this panel. And thank you to Dr. Athapattu for those kind words of introduction. Let me share my screen and see how that goes. I think somebody has to give me permission to share my screen.
Taraka or Dr. Chatura, can you give permission, screen share permission?
So let me talk while that happens. As Dr. Athapattu mentioned, I'm the Chair Professor of Economics at the Department of Economics and Statistics at Peradeniya. I'm also a non-resident fellow at Verite Research in Colombo. And the reason I mention this is because a few of us at Verite Research, mainly the other non-resident fellows and the executive director, have formed something called the policy, I think we call ourselves the Economic Policy Group. And I have presented some of the things that I am going to present today, some of the proposals that I'm making, I have presented to that group, and we are exploring them further with a view to encouraging the government to take them up. So that's sort of background for who I am and the different hats I'm wearing. Talking about what I'm going to present today, there's really two questions that come up when we talk about this. Who needs to be protected? Okay, I think I can now share my screen. And there we go. So that's who I am. And this is what I'm going to talk about today. So who needs to be protected? That's a need for targeting and identifying the needy and determining who would be eligible for support and in what form the support will be given. In cash transfers, in-kind transfers, and what delivery mechanism? So these are some of the questions that really are important in this entire issue. And I've organized my presentation so that I will first motivate the need for targeting and the need for broad targeting. Then when it comes to identifying the needy, I'll be talking about the correlates of poverty and inequality, as well as different distributional impacts of COVID-19. Then I'll talk a little bit about the social protection system in Sri Lanka, main characteristics and weaknesses, what happened during COVID, and then I'll be assessing proposals for going forward. So there I'll be talking about UNICEF proposals, World Bank proposals, and then, as I mentioned, the proposals that we are still in the process of formulating as the economic policy group at Verite. So these are some of the dimensions of poverty and vulnerability in Sri Lanka. Consumption and income, demographics, geography, and so on. I am going to be, if I may go back to where I was here, the main thrust of what I want to talk about today is these two questions. In order to address these two questions, I'll be presenting a lot of data. And I'm afraid that's a weakness of mine, that I want to show you everything that has been ever written on the subject. So I will be going rather fast, but I'm happy to share my slides. Apart from some work that has been done by some of my colleagues and myself, most of what I'm sharing is actually available in the public domain. So let me proceed. So this is from the DCS poverty indicators. And what I want to draw your attention to is, so these are the three distributions of per capita household expenditure. And what I want to draw your attention to is the shape of these curves. So in 2012, we had a sort of a high peak at a fairly low level of income. These incomes, by the way, are in rupee terms. They're not real over time. Each color is related to its own poverty line. So as we move rightwards, there's two things happening. It's basically increasing in real terms as well as in nominal terms. But the important thing is that this shape, the curve, is flattening, right? Which means that the poor got less poor. Now, I'm expecting that with COVID and with the current crisis, right, that this blue curve, which is where we are now, this is the 2019 curve, is going to be shifting backwards. So when I say where we are now, this is the data that we have, the most recent data that we have. But now in 2022, we know that this is changing, and we have some idea of how that will look like. But before I go there, I just want to give you this table from the 2019 HIES report, which talks about household income deciles. And again, this is just to give you an idea of how income is distributed in Sri Lanka, right? Most of us, I think all of us who are here on this webinar are in the 10th decile, right? Maybe we might know where, say, people we employ fit in, people we employ to do, housework or garden work. From the salaries we pay them, we know where they would fit in. But essentially, this is showing us that a lot of people who were earning these incomes in 2019 are going to be finding it very difficult now. So that we may not be looking at targeting the bottom 20%, we may be looking at targeting at least the 40%, perhaps even the 60%. And here's something from a UNICEF study, which shows that somebody in the 75th percentile, who's hit by a 30% loss in income, would fall to the 52nd percentile of the pre-COVID welfare distribution. So this is motivating the idea that we have a lot of people who are needy. Over here, the same study looked at the potential reductions in monthly household incomes during the crisis. And something that's very interesting is that a lot of the reductions were experienced in the middle of the distribution, not so much at the bottom. Now, moving to demographic factors, the national, this is just to let you know, at the national level, according to the old poverty line, only 3.2% of the population was poor in 2019. But they updated the poverty line, and according to that poverty line, 14.3% of the population was poor. Now, if you compare these figures against the national figure for poverty, we see that young people, basically below the age of 24, right, are higher than the national average, right? So households that have young people in them are poorer than households that don't have young people in them. And you will also notice that for the 0 to 4 age group, that's the highest incidence of poverty, followed by the 5 to 14 and so on. We also have multiple dimensions of poverty, and we see that actually there's in several dimensions, there is, and we have known about nutrition for a while, but there is in many of these dimensions, we have high child poverty. What about gender? So the DCS came up with this table, which shows that very young girls, when I say very young girls, I mean 0 to 4, okay? And women in their reproductive years, in their younger reproductive years, so 15 to 24, and elderly women over 60 plus are poorer than their male counterparts if we use the updated poverty line. Now, this is work that I did using the HIS 2016, trying to explain variation in the log of per capita expenditure. Now, that's per capita expenditure is what's used to determine poverty levels. And basically what I found was that roughly 1/3 is explained by variation in education. Another 1/3 is explained by household size and household composition. So children, elderly, disabled, ethnicity, age, and so on. And then this other 1/3 is what I have broken up here. And of that 1/3, 21% is coming from district. So which district you live in actually has a large part to play in what kind of earnings or consumption expenditure you have. And then this is several other things: farm households, net paddy producers, landless, all perhaps less than one expects. Wage employment is something that contributes to the variation. Remittances do contribute to the variation. And over here, this variable that's called access is the time to the nearest bus stop, and that contributes about 3%. Now, before I move on to the next thing, this is something that when I was doing that study, something interesting I found. You will find that if you look at poverty by ethnicity in Sri Lanka, which we don't do very often, you will find that all the ethnic groups other than the Sinhalese have higher incidence of poverty, right? And this is, at first blush, this is sort of disturbing and worrying, right? What I have done here is simply controlled for different things as we go along, right? The first one is not controlled. The second one is controlled by educational attainment, right? The second one is controlled by all the things you saw in my previous slide. And the last one has, it's only in the last one that we control for district. And what you see is that actually all variation disappears when you control for, all ethnicity as a source of explanation disappears when you control for district, right? Now, just like ethnicity is highly correlated with geography, so is demography. So if we take the districts of Sri Lanka, we can see three kinds of districts based on the dependency ratios, whether it's a child dependency ratio or an older age dependency ratio. So this is important because of something that I'm going to be proposing, and I'm going to start moving a little faster now. Okay. So this is differences in density, distance density, and agroclimatic conditions have given rise to structural inequalities between regions that are manifest along multiple dimensions of deprivation. And these are some work that myself and Dr. Tusita Kumara from UWA worked on. We calculated HDI, GDI, GII, and we compared those with consumption poverty as well as multidimensional poverty, and also population density. And we found that there were actually correlates, and we see here the northern and eastern districts, and to a lesser extent, the estate areas. Now I'm going to move to a few more slides that show this. So multidimensional poverty by district, again, we see the dominance of the estate areas and remote areas, right? Like Monragala district in multidimensional poverty. Now here I have log per capita consumption deficits from the Colombo district. So Colombo here would be 0. And this is how much lower than Colombo the other districts are. This last line is giving you the lowest 6. And again, we see dominance of the northern and eastern districts as well as the estate. This is something that is actually the basis on which DCS does its sampling. There's a lovely paper from which I got these categories, and it's on the DCS website somewhere. But basically, these categories make a lot of sense. So they're province sector categories. And again, you see estate sector dominates. Then you have the northern and eastern, northern rural, eastern rural, UWA rural, and so on. Okay. And all of this is relative to urban Western. Okay. Now, again, before I move on, just a couple more things to say in this area. The percentage of the estate population in the bottom 40% of the national population, this was in 2012, was 60%, right? So that's also telling us that if we target the estate area, we have a fairly high probability of getting the neediest people. And this is the kind of deprivation that they are dealing with. Just a couple more things before I move on. And this is nighttime lights. And the white lights are sort of standard lights that were there even in 1992 or 2002. The red light areas are the ones that were new. So we can see there's been a spread of electrification, and we know that 94% of households, I think, have electricity. But there's also the night lights and this spatial information tell us that there is this sort of strong sort of conglomeration effects in the wet zone, if you like to call it that, of Sri Lanka, right? Now, those are the same areas that suffered worse losses during COVID, and these are not my calculations, this is from the UNICEF report. So we see the Western province actually had the most losses. And Uva, for example, which is one of the poorer provinces, had fewer losses because of the continuation of agricultural work on the estates and so on. So, okay, now I would like to move on to the social protection system. Sri Lanka has apparently 40 social safety network programs in administrative data. And in HIES data, there's 7 social safety net categories. And there's a match of 3 between these two, which account for about 8% of programs, but 68% of the social safety net budgets. The important thing about this means that we have information from the HIES on 68% of all social safety net budgets. And a lot of our distributional information is coming from there, okay? So let me move on to a few things here. Maybe I will move very quickly here. These are, on the left-hand side, this shows leakage of the program, in the sense that if there's more of the green, gray, yellow, and red, you're giving away more to higher deciles. And this side shows undercoverage, right? And I'm not sure whether you can see my full screen and you can see what each of these are, but let me go very quickly. So there are some instances when we are doing reasonably well, but there are some instances when we are doing pretty poorly, right? But despite considerable leakage in both Samurdhi and the school lunch program, they are better targeted than fertilizer subsidies, which you can see in this graph. Samurdhi's targeting performance has worsened since 2009. And it has a negligible impact on poverty. Now, this is somewhat old analysis. This is coming from 2012 data and a 2015 study, but there's more recent work that has been done. This is also 2012. And you can see here from a geographical basis, district-wise, these are the total number of poor. these are the poor beneficiaries in those districts, and these are the non-poor beneficiaries in those districts, right? And I think it's just worth pointing out that we have here Hambantota, Ampara, Gampaha, Ratnapura, and Kurunegala, where the people who get Samurdhi vastly exceed the number of people who are poor in those districts. And very obviously, there are many non-poor beneficiaries. But even so, and the poor beneficiaries are very much less. Here's a more recent, using more recent data. This is from the UNICEF study. And essentially, they worked out that the error of exclusion is 58%. The error of inclusion is also 58%. And the correctly selected for Samurdhi is 42%. And households under this black line receives Samurdhi. Now, there's something I'd like to mention here, and that is that many of these people who were erroneously included in Samurdhi probably now need it. So we shouldn't be worried too much about these people, this lot at least. But we should be worried about these people who are in the lowest, 20%, who did not receive Samurdhi. Now, this is from work that a colleague of mine did, and she found, she basically looked at the probability of access to Samurdhi. And she looked at it in terms of undercoverage and leakage. In other words, what were your characteristics if you did not receive Samurdhi but should have? And district was the biggest contributor to the probability of being poor but not getting Samurdhi, 34%, followed by the age of the household head and local special characteristics, right? So local special characteristics being that, time to bus stand and so on. Leakage, what were your characteristics if you were likely to get Samurdhi when you didn't deserve it? And the one that contributed the most was education of the household head. And the others, district was there again, and employment characteristics. So in some sense, there is a fixable problem. If we can target our districts properly, if the budgets can be allocated properly to the districts, then we have one of the problems fixed. Now, this is a point that the UNICEF study makes, and that is that if you take Sri Lanka's social protection system, we have civil service pensions, that's our pensions, and provident funds and so on. Military benefits also come in here. And we have some of the senior citizens and disability allowances at the bottom, but we have this missing middle. And this was written in 2020 before, trying to estimate the effect of COVID, but it has significance for where we are today as well. So the proposal that UNICEF makes, right, is for inclusive emergency life cycle protection. So they talk of child benefit, disability benefit, and old age pension. So these exist in some ways, but what they're proposing is an increase. Let me hurry up a little bit because I'm aware the second presenter has to leave soon. So they worked out what happens if this life cycle benefit is given, and we can see that a lot of the benefits go to the bottom deciles. Now, this is moving to the World Bank recommendation. This is a proxy means test, and it's gazetted basically in 2019. It has been gazetted by the Minister of Finance, then Mangala Samaraweera. And the World Bank has calculated that if this test is done and this method is used, there will be a much better distribution of households than under the existing distribution of Samruddhi benefits, right? Now let me move to, before I talk a little bit more about that, let me talk a little bit about delivery mechanisms. So when we are thinking about, whatever our transfers need to be, are we going to use existing mechanisms? Are we going to do some kind of direct deposits to bank accounts? Some people have talked of using supermarkets. Some people talk of using phones. So I am not going to talk about that, except to present this, which is actually my one but the last slide. And this is basically taking the dimensions or the indicators that are there in the World Bank proposal. And basically looking at them from the point of view of targeting efficiency and from the point of view of determining eligibility as well as delivery mechanism. So this is a question of, is this a good indicator? And this is a question of, do we have a sort of a foolproof way or close to foolproof way of delivering it? And so my color coding is fairly self-evident, right? The ones that really work, so geography is there. Geography is not part of the World Bank indicators, by the way, but I'm putting it up there because we had such a lot of evidence for geography. But here's something that we can talk about. And in terms of indicators, as we saw, age, young children is important. What about determining eligibility and delivery mechanism? We have two existing mechanisms in place which can help us to do this quite easily. And that is, in the first case, from 0 to 5, that is using the MCH, the maternal and child health clinics, the PHW, who knows, who every child is below the age of 5, and the MOH, the MO, basically working through the MOH areas. I think this would be a very good way of going about it. What about the older age group? I think we need to strengthen and deepen the school feeding system. Two more. Electricity consumption. What the World Bank proposes for the proxy means test is to include those who consume less than 60 kWh as poor, and those who consume more than that as not poor. So if we take electricity consumption, this is something that can be actually done in terms of the delivery mechanism along with the electricity bill. So it's not that you're subsidizing their electricity bill, you're actually doing more than that. You're giving them a cash transfer through their electricity bill. And since 94% of Sri Lankans are connected to electricity, they purchase electricity, this is going to get, the issue of undercoverage is not a big problem. It is a problem in the sense that 6% are probably people who need that as well. But the hope is that the 6% will be covered in some way through the others. The final one is the one on health. And I think already kidney patients receive a transfer from the government. Here, what I would suggest is, again, we use the existing mechanisms. And that is that we use people who use the public health service, who have a card, basically, and this would be for chronic illnesses, and for, deeply serious chronic illnesses, like patients who are on dialysis, for example. So that's basically my set of best candidates. And I must say that from the Verite Economic Policy Group, these are the two that I was able to convince them of, right? But these are the others that are possible. So I will stop here and apologize for, I hope, not taking more than my time. But thank you very much.
Thank you, Professor Gunawardena. That was a very comprehensive presentation with support from data on the various recommendations that you made. And I'm sure the participants will have a lot of questions. So we will try to take them at the end of the presentations, as I mentioned earlier. We will quickly move on to the second speaker, as Dr. Kalana has some other conflicting commitment to meet. Our second presenter is Dr. Kalana Pires. He's a program and policy officer in charge of nutrition at the World Food Program in Sri Lanka. He's a graduate from the University of Colombo and professional physician by profession. And he has long years of experience in the region, working in the Nepal and Lao PDR and some other regional programs, and presently in charge of the Sri Lanka program. And in his presentation, Dr. Kalana will be focusing on one area where we have been experiencing a lot of challenges in addressing the vulnerable groups, the nutrition aspect. So we will talk briefly about the nature of the problem, the malnutrition incidence in Sri Lanka, the status, and some of the nutrition intervention programs that are being implemented and how they can be used as a mechanism to address the current and looming issues. Over to you, Dr. Pires.
Thank you, Dr. Nihal. And I think I have I have two challenges. One is actually being equally interesting to making the presentation equally interesting to what Dr. Delaney made a while ago, and also trying to meet my other commitment and quickly finishing the presentation. I think a very informative presentation. Thank you very much, Dr. Delaney, upfront. So my objective here is to quickly give a very broad overview in terms of the situation of malnutrition in Sri Lanka, but particularly I'll be talking about the underside of it, not the over side of it, because that is what is actually becoming more relevant at this time when it comes to the current crisis. So I will be talking about the status of malnutrition currently, mainly, as I said, from the kind of the lower side, the underside, and then how it has impacted the different vulnerable groups, taking a couple of examples. And I'll be giving a very broad overview of some nutritional supplementation programs as examples of what has been done to address the situation. So when it comes to malnutrition, I think one of the greatest undernutrition, one of the greatest challenges we face right now is we have to use data that is quite outdated. We use the reliable data source for nutrition here is the DHS, and the last DHS was 2016. And I think under normal circumstances, malnutrition wouldn't have changed within 5 years, but currently I think DHS data is no longer relevant, but that is what we have. And I will use a couple of other sources which WFP has also been part of in producing, to give a picture of what's happening in the nutrition side. So as we know, like when DHS talk about it, the low birth weight percentage has been quite stagnant, around 15-16% over the past 2 decades. Then childhood under 5 undernutrition is one of the challenges that we have been facing again over the past 2 decades, which sometimes show statistics that put us in par with some of the worst affected countries in the world. So as you could see here, this is directly adapted from the UNICEF report, which is a great diagram. And as you can see, not only the undernutrition, but also micronutrient deficiency. Deficiency is highlighted by iron deficiency, anemia, and other micronutrient deficiencies is fairly high in this age group. And even amongst the older children, as you could see, fairly high wasting percentages, although these are like moderate level, and we don't see much of mortality around it. Things were therefore not taken very seriously, perhaps, because I keep hearing in other countries that this level of wasting or thinness, around 40%, would raise a lot of alarms, and people would be panicking, but we don't seem to be kind of responding at that level to this magnitude, mainly because the morbidity and mortality had been lower, but things are changing now for the worst. And yeah, again, anemia continues to be a problem in this age group, and Dr. Delaney talked about school meal program, and school meal program covers this age group mainly. And then the women 15 to 49 age group, again, there you see even the other side of the spectrum, the overweight and obesity is a problem, where around 45% of women between 15 to 49 years are either obese or overweight, which is also concerning. But when it comes to pregnant women, again, high level of anemia, underweight, and even iron deficiency and other deficiencies you can see. So this is the picture before COVID. This is the picture before economic crisis. So these indicators are only, we can only say that these are going to be, we will be seeing this going worse to worse due to the current crisis we are facing. Yeah, and I hope you can hear me, right? Yeah, and
yes,
then
you're coming through fine. Yeah.
Yes. So if we look at these couple of examples as examples, the two vulnerable groups that have been identified over the last years, especially for nutrition. are like estates and the poorest well people. So if you see if you compare under 5 stunting, it's close to close to twice as much as the national level in estates, and even in the poorest quintile of people, it is around 1.5 times higher. And when it comes to poorest quintile, even wasting is high, and because stunting is so high, estates don't show a higher percentage in when it comes to wasting, but that's something statistical. And if you see the underweight percentage, it is more reliable in that context, and it is higher than the national average. And we know anemia is also higher, although DHS doesn't talk about it. And similarly, the other example is among the pregnant women. If you can see, short stature is more, and then the pregnant women with mid-arm circumference of less than 23 centimeters, which is a good measure of acute moderate malnutrition, especially for screening purposes. It shows much higher value than the national average in estates, as well as lower poorer quintiles. And also anemia is very high in the estates, as well as the poorer groups. So as you can see clearly, the in terms of nutrition, as you can see, most of the population is affected, but I think particularly the estates and the poorer quintiles, wealth quintiles, are more affected, significantly more affected than rest of the population. And as I said, more recent data is quite scarce, and that is one thing that WFP, UNICEF, and WHO are looking at right now, whether we can have a rapid anthropometric survey, which may not have to be very representative, but at least to get an idea around how the worst affected population groups are doing in this crisis. But more recently, MRI published some report on the gaps in energy and nutrient consumption, sponsored by WHO. So fairly lower sample size compared to the DHS, but it shows some kind of reduction. But mind you, this data is, although this was published in early 2022, the data is coming from October to December last year. It is surely affected by COVID, but not so much by this worse period of the economic crisis. So we don't know how the situation is affected by the worst period of the economic crisis. So if you take food as a determinant of nutritional status, as you can see, food security level, this is actually showing on the picture on your left hand side. The map on your left hand side shows the percentage of households that cannot afford a minimum cost of nutritious diet. I'll tell you briefly about what is cost of nutritious diet, which is a methodology to calculate a theoretical cost of a diet that would meet different nutritional requirements. It can be energy only, or it can be something that is including more range of nutrients, required nutrients. So this is the minimum cost of nutritious diet, that is like fulfilling the basic nutritional requirements. As you can see, and then the other thing is how much of a population, the proportion of population who can not afford the recommended diet. This was actually a World Bank study. So as you can see, some of the worst affected districts are in fact, as Dr. Delaney was pointing out, are affected in more than one variable. Yeah. And on the right hand side, you'll see the household expenditure spent on food. As you can see, urban, rural, and estate sectors. Estate sector as a percentage spends more on food than the other sectors, which also suggests a close relationship with the worst nutritional conditions there. And of course, this was pulled out from the HIES in 2019. If you compare how much average monthly household expenditure among in estate sector on the three main iron-rich food sources, food groups, and their expenditure on drugs, tobacco, and liquor. I can share with you a quickly anecdotal finding that while we were doing the rapid food security assessment, was that so due to the increased food prices, the monthly food pack that usually estate sector household would buy has gone up. The price of that pack has gone up by 100%, and it is actually has become twice the cost, and they are unable to meet it. And mainly this food pack is bought by the salary of the woman, and the salary of the man never even is spent on anything on to do with the family or the household. So this is a big problem, which is also a food for thought in discussing this further. I think for the last few months we have seen growing food insecurity within the country, especially within the last 5-6 months, and over two-thirds of the households now report falling incomes. This is based on the rapid assessment WFP and National Planning Department undertook in the month of April, and also like more than 75% of the households that were surveyed have reduced their food consumption, and they are like resorting to coping strategies such as borrowing. This is another aspect of the food insecurity. 38% of people are facing moderate and severe food insecurity, and this is also from the rapid food security assessment that we conducted. People anticipate fertilizer problems and fuel shortages to continue. And this is from my this assessment is from April, and more than 86% are relying on simple to moderate to severe coping strategies. For example, now I'm showing you on the left, the blue graph shows in 2018 what was the cost of the diet. So the energy only cost of the diet is actually cost of a theoretical diet that would fulfill one's energy requirements only. And that has, if you compare that with the orange graph, it has, while that has marginally increased, if you can shift to the next graph, which is actually a nutritious diet, which would fulfill nutrient requirements of a wide range, you could see that it has increased nearly by threefold. So this is a snapshot of what's happening right now. And these are like based on this is based on Dr. Correlated work on this matter done in April this year. And if I talk quickly about on the national school meal program, this has been done since 1931, and around 1 million, little more than 1 million children, and 80% of government schools are covered through this program, and it's only the primary school grades that is largely covered. And this, as we know, improve school attendance, and then they get one of the main meals that they miss out from home, the children. I mean, then since these are more diverse menus that the schools provide, they tend to meet the vegetable and fruit intake targets. And there are a number of benefits like that, not only on nutrition, but also food security and even education on this, and some economic benefits to the local communities is also visible. Then if we move on, however, now this is a glimpse of what's happening for the budget allocations, national budget allocations for the school meal program over the last 3 years rather. And this year, as you can see now, in 2020, expenditure on the national school meal went down because of COVID school closure. But other than that, 4 to 6 billion rupees have been allocated and spent in on school meal. But this time suddenly the budget allocation has come down to 2 billion, which makes it impossible to run the program all throughout the year. And if you see, like the government actually pays the school meal caterers 30 rupees per meal per child. But when we used the WFP's tool to calculate school meal menu costs, we find that average cost of a meal has gone up to 49 rupees, or for 50 rupees, nearly 50 rupees for the same menu. And that means the caterers who are generally the poorest, like the Samurdhi beneficiaries or the parents of the school children, who are supplying the school meals, are finding it very difficult to meet the recommended targets for the meals. And quickly moving on to some other nutrition specific programs. You have all probably know about Triposha program, which is covering the entire country and approximately around 1 million children who are 6 months to 5 years old. The target beneficiaries are particularly the children with moderate acute malnutrition and who show growth faltering over a consecutive 2 months period. And also all pregnant and lactating women are covered. This is implemented by the MOH, and there are a number of other initiatives like that. And of course, I would also like to kind of highlight here the cash or value voucher that is provided to pregnant and lactating women. This was initially provided for 10 months, last 6 months of the pregnancy and the first 4 months after childbirth, but now it has been extended to 2 years, but it has not yet been implemented because of the shortfall in the budget. So I would stop at that. I'm sorry if I had to kind of rush this presentation, but I'm happy to take up a few questions because I have to run to another meeting quickly. But I see already a couple of questions. Yeah, Chatura. Yeah, so yeah, I would share the rapid food security assessment report with the forum, and which can in turn be shared with the participants of today's call.
Dr. Peiris, there's a question from Professor Temchandra Tukorala. Can you give a quick answer to that? He's asking about an estimate of the total cost outlay, including the admin costs of those SSN programs.
Yeah, so school meal program. Yeah, the administrative costs are I think it's that is the only thing that is not very straightforward to calculate, because some of these staffing costs and all that may overlap with other programs. But I know you are the economists and you may know better. But of course, the program costs are quite straightforward. We can obtain them from the relevant implementing agencies, and they are costly. Actually, when we were trying to also put in some of the costs for these programs through the appeal, we found it to be very costly. And for example, this school meal program at the current rate of 30 rupees per meal per child costs about 6 billion rupees a year. Yeah, so of course there are like considerations to be made.
No, Nihal, my question is relating to all the program. Maybe Delaney can help us to understand, because I want to relate the discussion to what Shanta Devarajan and others have been advocating, the UBI, Universal Basic Income. When you take into account all these programs, what would be the cost? Yeah.
Okay, thank you, Professor Premchandra, for the clarification. We will take it up during the discussion again. Yeah. Since Dr. Kalana is under time pressure, maybe we can directly sort of deal with any question that we need to ask from him. And there's like a quick question I would like to ask him based on some of the presentation material. Now, discussing the school meal program, for example, I mean, you mentioned the difficulty faced by the suppliers of school meals in sourcing material. So in the kind of situation that is going to be rising in future, which of these nutritional intervention programs do you think would be robust enough to be expanded and used? Maybe some of the programs will have to be transformed into different types, like maybe financial assistance. Some of the programs can be continued in the form of in-kind assistance. Any quick comments, Dr. Kalana?
If I respond to it very quickly, Dr. Nihal, I think, yeah, these programs have been time tested, especially the Triposha program and the school meal program, for example. They have been, there for a long time. But I think due to the changing situations, and I think what we have seen right now, is quite unprecedented in terms of challenges. So I think these we will have to kind of find out what can be continued as it used to be, or like most of these programs will have to be reformulated or like looked at in a different manner, a different more robust financing mechanism and other things need to be looked at into when it comes to continuing with these programs. Yeah.
Okay, thank you for that. Yeah, we will. I think certainly there will be more discussion on that. There's one other question that has been, in the discussion debate earlier about this rice fortification.
Yeah.
This has been discussed. Is there a scope for utilizing that in the coming period?
Now, for this immediate crisis assistance programs, we've included fortified rice as a an assistance, in kind assistance, or food related assistance, mainly to the school meal program. Certainly it plays a role because it would improve the nutritional quality of the meal, and sometimes it reduces the cost of the diet by a significant proportion. So so it is a useful mechanism, but then again on the medium to long term we have to think of how we as a country can sustain such an initiative, which WFP has produced a lot of knowledge around over the past 2 or 3 years. Dr. Dilini Hemachandra has been working with us, and few other colleagues who are also here in this forum have worked with us in producing a lot of knowledge around how this can be done. Definitely, yes. Thank you for that question.
Yeah, thank you for taking it on. Looking at the success of the salt iodization program, for example, many were thinking that there was a scope for rice fortification as well. We will look forward to see more dialogue discussion on that. And I thank you, Dr. Kalanam, for staying with us, even though you were required a little bit earlier, but you were patient enough to respond to some of the questions, and I thank you on behalf of the organizers. And if you can join us later again after your meeting during the discussion session, we would really love it. Thank you very much.
Thank you so much. Thank you, Dr. Nihal. Thank you.
It's my pleasure to now introduce the third presenter. It's Dr. Suresh Babu, and Dr. Babu doesn't need a lot of introduction to the Sri Lankan audience. He has been worked with us in say many projects, so he's quite familiar with the Sri Lankan situation. Right now, Dr. Babu, as you all know, is a senior research fellow and head of capacity strengthening at the International Food Policy Research Institute. And he's a graduate of University of Iowa State University of US, and then he has worked internationally in a number of countries and continues to do that through IFRI programs. And during his presentation, I think we will get some valuable information on the international experience in the way this kind of crises have manifested in other countries in terms of disproportionately impacting the vulnerable and the poor, and the type of measures implemented targeting them. We all look forward to that information, which will be of quite value to Sri Lankan audiences. Over to you, Dr. Suresh Babu.
Dr. Nigal, thank you so much. Can you hear me and can you see me the screen? So you see the screen?
Yes, we can see your screen and we can hear you very well.
Thank you. Thank you for this nice introduction. And I particularly appreciate the last two presentations because they were probably very well expansive in the context of what we are facing right now, both in the context of targeting and what are the options for actually the delivery mechanisms that Dr. Delaney presented. And of course, Dr. Kalana brought the broad challenges of nutrition and health issues that we are facing. So to kind of wrap it up, it may be useful to think about what is happening in rest of the world, and that is the objective of my presentation. And it is actually collaboratively done with Dr. Jivika Virahiva and also Dr. Pradeepa Correlated from University of Peradeniya, with whom we have been working for some time to think about how we can actually come up with the least cost diet, and we are working on a policy brief on that. And my participation, particularly in this forum, as well as with collaboration with IPS in Sri Lanka, as well as Peradeniya, is supported by the USAID Innovation Lab for Food Security Policy Research, Capacity and Influence, we call PRCA, and also RESAX Asia program facilitated by IFPRI. Just to mention that I'm able to do this mainly because of the support that I'm getting from the programs at IFPRI and USAID. Just moving on, quickly, we know about the economic crisis, and there is no doubt that we are facing a challenge and a crisis situation. But as popular Chinese proverb says, every crisis is an opportunity, and we should not miss this crisis to build ourselves better and build the resilience that we need, and also come out more successfully. So from that perspective, what has been happening in the rest of the world in terms of crisis, particularly because Sri Lanka, as you know, has a well-established infrastructure for long time. And you talked about the school feeding program from 1930s. So you have a solid infrastructure, and Sri Lanka has been an exemplary country for social sector spending. And we always point out to Sri Lanka, even in India, for example, when we deal with the policymakers. And Sri Lanka and the state of Kerala, for example, has become an example over the years of how social sector spending can actually improve the development process. So the basic infrastructure, basic institutional architecture is in place. And we saw that in the last two presentations. So there is no doubt about that. But how do we, in the context of crisis, in the context of the issues related to fiscal issues, sustainability issues, scaling up issues, and more people coming into poverty and malnutrition, how do we address that? That's the context of my presentation. So that crisis-related intervention, how we can take advantage of a crisis in order to build ourselves better, right? What lessons we can learn from this process. So quickly, we already saw this for making this presentation a complete one. So for someone just looking at this presentation, there is a little bit of a background that we already talked about in several presentations. Even in this series, you can find this discussions, the culmination of various economic policies, a little bit of a failures from economic perspective, and also the COVID coming in and poor choice of policy instruments have kind of put us in this crisis situation. But of course, we can think about how particularly in the context of food inflation, the price inflation that is really affecting the poor and the vulnerable, what are the interventions and what are the delivery mechanisms that we should be thinking about, and what does the other countries show in their experience? That's something that we'll be talking about. And we already know these graphs from the price levels going up. And Dr. Jivika was telling me that, in fact, this has become obsolete now. The price inflation is about 64% in Sri Lanka. So that's kind of a changing and evolving issues that we should be keeping close eye on. And then the recent humanitarian report that has come out talks about 5.7 million people being affected by this. And particularly the issues related to chemical fertilizer bans we need to think about not just the intervention in terms of vulnerability and poverty and how we can target, but also how we can come out of this situation in a sustainable manner. That requires looking at going beyond the targeted interventions to other interventions that may relate to long-term, medium and long-term sustainability building, resilience building kind of interventions. We'll talk about that in a minute. So that gives kind of the background to what we have been facing. But let me, and Dr. Jivika and a few of us joined together to develop a policy brief on fertilizer ban and what impact it has on the food systems, for example, in terms of yield losses, income losses, pushing people more into poverty, and also increasing the food import bill, for example. The less produced, you have to import more, and the rent-seeking behavior, and it's all documented in the policy brief. If you're interested, we can share with you. But that's one aspect of how the badly managed economic instruments have brought us to this situation. But more importantly, in my presentation with limited time, I will talk about how this social safety net, particularly during the crisis time, has helped in different countries. And I just bring that
tax on the tax increase. This is simply, so there are two things that are being proposed. One is simply bring back the PAYE system. So, for some of us that actually happened, right? In the universities for 3 months of 2019, we didn't pay taxes. And then from April onwards, we paid, those 3 months plus the taxes we had to pay. So similarly, in the formal sector, there will be people who are not, basically it's not a question of not paying taxes. What happened was you were told that you are now responsible for your taxes instead of it being taken away at source. So these are what you would call stroke of a pen gains. So they don't need to be long-term or even medium-term. It can be done immediately, simply by a gazette, I believe. And then what you will have is that employers will then submitting taxes, will be taking off taxes from your salary. So that's the PAYE. The tobacco tax, and I have to say I am not too familiar with the tobacco tax, but the thing with the tobacco tax is that because we are, because of elasticities being fairly low on that you simply increase the tobacco tax and you will get income. You will get tax revenue. This is partly in lighter vein, but partly serious also. One of the comments that I think I received directly, and then also second presenter mentioned the whole issue of the spending on alcohol, tobacco, and so on the estates. And I think one of the ways to address that is perhaps just to make everything more expensive. Less available and more expensive. Less available is difficult to implement because then you end up with somebody getting bribes in order to make what is supposed to be not available and so on. But if you just make it expensive by increasing taxes on alcohol and tobacco, you have a way of bringing in revenue as well as hopefully reducing consumption.
Yeah, thank you, Professor Gunawardena. Now, you actually took on this earlier. Crisis times may not be a time to do a lot of reform. But when you speak of the Samurdhi program, everyone had been observing the high administrative cost and the waste they are on. And now in doing, say, crisis management, you also, if there are some opportunity to make corrections, you also want to make use of that. So in that sense, do you see any prospect of reforming some of the program in some way so that there can be going forward a better administrative mechanism.
So I think, I mean, what I know of the World Bank, what's happening at the moment, is that the idea is that they centralize the database. So that's for all social protection programs. But they also have this proxy means test, and then databases are again, fixed. And presumably the proxy means test, like I said, I'm skeptical about it because it actually involves sort of calculating a fairly complicated score in order to figure if somebody is poor or not. But if that's actually going to be done, then there is, it's less difficult to fiddle around with by a Samurthi Niyamaka. But yes, I think I would say the long-term goal should be eventually to do away with the position of the Samurthi Niyamaka. But it's a very difficult thing, which it came in way back when, and it survived many different Samurthi ministers and so on. So I'm not sure how possible it's going to be. But I agree with you that certainly if there's an opportunity and this administrative cost is large, and we have been talking about it for the longest time, that perhaps it would be good to do away with it.
Then UBI is not an option.
UBI. Yeah. So my feeling about UBI is good. My worry is that we are then benefiting some people, that basically the whole exclusion and inclusion errors. Mm-hmm. I mean, there are at least 10% of the population who simply have to tighten their belts, myself included. It just means that we are going to be, for the next 2 years or however long this crisis takes, we are going to suffer losses. And I'm not sure that, so that's what I don't like about the universal income. The universal child income has the added thing that, you're treating a vulnerable population. There's evidence that households that have more children are also poorer. So that's why I prefer the universal child support grant than a universal basic income.
Yes, now we after the technical problem we had, most of the participants have been able to rejoin, but we have not been able to get Dr. Suresh Babu back online. So he has actually sent his PowerPoint presentation, which we can share, but his presentation, I don't think is going to happen right now. So in the absence of that, we will continue with the discussion. And if any of the other presenters, other participants have a question to raise, we can definitely proceed with that. And so it's open for you to either raise hand and ask questions or type in. I mean, you can unmute yourself and ask a question if you want.
Dr. Atapattu, I would like to ask a question from Professor Gunawardena.
Yeah, please go ahead. Yeah.
I'm aware that Professor Gunawardena has been working with the data collected by DCS surveys. So in a crisis situation like this, isn't it mandatory for a government agency like DCS to launch national surveys to assess the situation? Because it looks like we are gathering information from here and there, and we rely on anecdotal evidences and coming up with yeah, I admitted him. Yes, coming up with appropriate programs to reach out to poor and the vulnerable is very difficult in absence of this kind of information. So, how do you like to see this happening?
Dr. Jimika, I'm just coming in. Sorry, I don't know when I lost you. I finished my presentation just now talking to myself, maybe. I am so sorry, and I realized the Zoom got disconnected in the middle. What a disappointment for me, but when did I lose you?
We lost you around the second slide, actually, and I had been sending messages. I had been sending messages to you, but somehow couldn't get through. But if you don't mind, I mean, we will certainly be available to go through your presentation quickly. Would you be able to do that?
I would do is just go to the last couple of slides and let if you're able me to share the slides, let me quickly give the summary at least one more time, if it is useful to the participants, because I kind of, I didn't know when I finished the presentation, I was not in Zoom, I realized.
Yes, sorry about that. I mean, it was a technical problem on our side. Yeah, please decide from where do you want to sort of reconnect, and then we have your PowerPoint presentation, which we can share, but please decide where you want to sort of start and finish it. Thank you.
No, it's okay. Now, just basically what I was saying is the broad message of my presentation is this. Sri Lanka already has the social infrastructure and the institutional infrastructure for intervening in social safety nets. The programs that Dr. Kalana presented, the mechanisms that Dr. Delaney talked about are actually, to my extent, to my knowledge, are in line with the international experience. And you have done extensive research on that, and you are already ready to get going with the interventions. And I talked about in my presentation the Bangladesh experience to some extent, the Latin American experience to some extent, which you all did not hear, and also the Indian experience. But we always come to Sri Lanka to look at the social sector spending and social sector interventions as an example. Sri Lanka and Kerala, state of India, are the two broad examples that we take to Africa and other countries, right, as an example. So you already have it. In the context of what crisis, what I was saying is that we need to be thinking about this crisis as an opportunity to reform our social safety nets. That's what the Latin American countries did in the 90s and 2000s. You know, they came up, they refined their programs of intervention. Now we have 47 social safety nets on the ground in Sri Lanka. Can we make them much more organized, much more targeted, much more resilience oriented, so that the people who fall into poverty trap due to shocks can use those programs and come out quickly of those programs. And then final point I was making is that how do we think about the transformation of the food system as well, because the graphs that the maps that Dr. Delaney and Dr. Kalana showed, this COVID-19 had a geographical kind of effect, right? That rural people were less affected, but they were dependent on their farming systems for that. So it gives a kind of insight for how we can actually help transform the food systems in the rural areas so that they can be self-reliant in the context of shocks, and also come out of the shocks with better resilience built in. In the context of climate change, it is also going to help. Let me stop here. Sorry about that. And I'm happy to answer any questions in the context of discussion. Thank you so much, Dr. Nihal.
Yeah, thank you, Dr. Babu. And again, sorry for and apologies for that mistake. And actually, you raised one important, made an observation that had also been in the discussion about this large number of social safety net programs that the Sri Lanka has. Like you mentioned, the World Bank study lists out some 30 plus programs. And now, in terms of efficiency improvement, there may be scope for consolidation of some of these programs. And perhaps you and maybe Professor Gunawardena also can make some observations on that. Again, going back to the difficult times for reform is one aspect, but at the same time, we should try to make use of the opportunity to try and maybe consolidate these programs so that their efficiency is improved. Any comments from either of you? Dr. Babu first and then Dr. Gunawardena.
Dr. Gunawardena,
yeah, maybe, yeah. Okay. Yeah, I think probably.
Yeah, if I can come in, Nihal, it's a very good question, right? In the context of Latin America, some of my slides, you may see the details there on some studies there. They actually brought in the broader scalable cash transfer programs. If you look at Brazil, extensively, the Zero Hunger program particularly gives us the opportunity to look at, because it's very similar to the universal base income approach, so to speak. They called it Zero Hunger program. And when I went to work with Brazilian colleagues in Brazil, and they took me to northern Brazil, you can see the cash transfer program, which was equivalent to about $250 to $300 per, it's quite a bit actually, to a vulnerable household in remote area. That income transformed these rural areas mainly because this income given directly to the bank accounts of this poor attracted a lot of small businesses to come to these rural areas. And in fact, it kind of started transforming the rural economies themselves, because this income was available with households and they have to spend it on their basic needs. The market mechanism started happening. More and more small businesses coming into rural areas, that it can not only help to reduce hunger and poverty of these vulnerable households, which were not reached by the mainstream economy, but also bring in the revitalization of the rural economies, remote rural economies. And that's one example of how Brazil kind of streamlined various rural intervention programs at that time. The second example of Mexico and Argentina gives us, to some extent, the Mexico program, particularly the cash transfer, conditional cash transfers, brought in the health and nutritional benefits. It's a primary health centers concept that Dr. Delaney talked about, right? You have Triposha already there, but how do you use that as a targeting mechanism? So you have a similarity there in Sri Lanka. In the context of India, for example, the two major things right now are targeted: the public distribution program, which was much more targeted now than 20 years ago, and also this ICDS program, which is equivalent to Triposha in Sri Lanka, the Integrated Child Development Program, and of course the school feeding program. These are three programs are the key intervention programs. The school feeding program now, the recent innovation is not only because of the COVID-19, not only the lunch was given before, it continues, but also they are introducing the breakfast program also for the people who are not able to take breakfast in their house, in their homes. So that's again an intervention that's additional cost, but it reaches more targeted vulnerable people. So broadly, this gives us an opportunity to re-evaluate how we can think about Triposha, the school feeding program, and of course, the other vulnerability programs that are the cash value voucher, for pregnant women we talked about, that Kalana talked about, can be kind of combined and made more efficient in terms of reaching the targeted population.
Thank you very much, Dr. Babu. Professor Dilani, you want to add anything?
Yes, just to actually draw your attention to the fact that though there are these 40 programs, about 68% of the spending is on these 3 programs that are also captured in the HIES. So, so in a sense, I'm thinking that perhaps, you know, as long as these are not sort of ad hoc things that, you know, some minister decides to bring in to support his constituency, that in a sense, they're specific, they're related to a particular ministry, and there is a reason they're related to a particular ministry. So say, for example, disability, so the Department of, you know, Social Disability or so on will deal with the disability payments. I'm not sure that is, well, I don't know that anybody has done a study to see how much administrative cost is involved in having these different, or say Ministry of Education handles a school feeding program. That makes sense to me. Ministry of Health handles Triposha. That makes sense to me. So in that sense, though, you know, at sort of on the surface, it seems like these are large and not rationalized. And I held that view as well. In more recent times, as I sort of look into what they actually are, it occurs to me that there is some sense in the way they are done. And I think what we need to do is actually pick on the mechanisms, pick on the administration that's working well and use them. And that's my, you know, that's my enthusiasm over the using the MCH. You know, I have used the PHW myself, and I know that it is a system that works very well most of the time, and I think it's one of the better systems in Sri Lanka, you know, in our public sector. So I think that what we need to do is pick on the administrative setups that work well and that have less room for sort of political maneuvering and so on, and use them.
Yeah, thank you very much for those insights. I think there will certainly be some space for discussion of this as we move forward. And in terms of time, I'm mindful of all the challenges people will be facing with power cuts and everything. We are almost at the end of scheduled time, but we can still, permit 1 or 2 questions if there are any urgent clarifications any of the participants would like to receive. And so over to you. If anyone wants to ask, please go ahead.
So there is a question that someone has addressed to me directly, and they've sent it to me twice. So perhaps I should read it aloud.
Please,
and this is about the estate sector. And how do we deal with the fact that, you know, they spend a large percentage of, and Dr. Kalna brought this up as well, they spend a large percentage of their income on alcohol and tobacco consumption. I'll just very briefly address that. I think, there are 2 issues here. One is we expect the poor to be rational. We don't necessarily expect that of the rich. And I am not sure, it is because we are considering giving money to the poor that we are thinking about this, but then our public health system is publicly funded. And we don't talk about the sort of irrational health behaviors of upper middle class people. So I'm not sure that I understand that it's an issue, but I'm not sure that it means that therefore we have to ignore this population. How can we address it? Again, one sort of very slick answer that I can give, and I already gave, was make it expensive. And I think, that's what we want to tax alcohol and tobacco higher for. Making it unavailable would be really nice, if we can. But that's easier said than done. So I'll leave it at that, actually.
Thank you very much. Any other comments, views? I think the silence means there are no more pressing questions, perhaps. And we have had almost 2 hours of lively presentations and discussion. And I think we were able to share a fair amount of information that will be of interest to the participants of this webinar series. And so with this, we will conclude today's webinar. And I would also like to invite the participants to keep an eye on the next webinar in the series. We will be looking at the trade sector issues quickly in some follow-up seminars, and also expect active participation of the community. And with that, I thank our 3 presenters who made an excellent contribution to enlighten us on this issue, and also the participants for interesting questions and comments. Thank you very much. That concludes today's webinar.
Thank you.
Thank you, everyone. Bye-bye.
Yeah. Yeah.
Thank you very much.
Thank you.
Yeah.
Thanks.
Thank you.
Yeah, thanks, Sisira.
Thank you.
Yeah. Thank you very much.
Yeah, Prof. Yeah, thank you. Yeah,
Thank
good,
you.
good to see you all always.
Thank
And I appreciate
Yeah.
your commitment joining from
No,
joining
these
at this
are
late
really
hour.
valuable.
in Sri Lanka. Yeah.
Yeah, no, it's
very
really, really nice to see that, you're really making the right contribution. Because
No,
evidence-based policy discussions are not, that has never been the tradition in Sri Lanka. It is sloganizing, and so this is a new, you are really doing something very valuable.
Yeah, I mean, it's my hope we can maintain the momentum and go forward. I mean, it was a good start, and so far we have been going fairly strong, and hopefully can take it all the way to the end.
Yeah.
And perhaps we can even think of maybe, I mean, when Professor Gunawardene was talking about this verite economic plan, I was thinking maybe we can try and collaborate with something ongoing like that, because as I started, I said at the start, we were thinking of doing something as economist associations, but maybe we can couple our efforts and come up with something more broadly supported by the community.
Yeah.
I mean, Verite has made a start, so something that we can look at. And there have been several other contributions coming in. So let's maybe at some point collate all those also, like Pathfinder Foundation and some other, like I think one of the trade chambers had been putting up their own recommendations. So we can try and evaluate. Yeah, Advocata, yeah. Maybe use our efforts, our analytical thoughts to evaluate them and see which of them can be actually make a change, make the kind of change that we want.
I mean, that would also mean that, you would get the more academic economists to interact with people in the private sector and social activist groups and so on who are interested in these issues. That kind of dialogue on a, where you draw on some real serious analysis rather than just slogans. That would be,
that's a message that came out strongly from Dr. Devarajan. I mean, in our second webinar also, that the need for us to do more, not academic, but applied research, which we have not been doing enough. So maybe we can catalyze some of that through this mechanism, and hopefully Professor Atukorala, Professor Sisira, you can help us maybe to have some more support in that, because that's how I think we have seen some valuable work happening in the past through collaboration with Sri Lankan scholars who are internationally experienced. So let's keep that in mind as we move forward. And thank you again for your presence and contributions. We will keep in touch. We'll see you at the next. See you at the next webinar.
Sure.
Okay.
Yeah. Bye.
Okay. Thanks, Jivika. Bye.
Okay. Bye.